All right, now to some health news this morning. The liver is an important digestive organ with more than 500 known functions. But what you may not know is that the incidence of liver cancer has increased in recent decades. Here to help us understand this and to talk about treatment options is Dr. Sukandi from the Digestive Health Institute at Advent Health Tampa. Good morning, doctor.
Good morning.
Glad to have you here.
Same here.
So let's talk about the liver. We mentioned about how many different, functions that it does. Tell us a little bit more about why the liver is so important to our daily life and health function.
Because the liver is an organ that we have to have in order to conduct our body metabolism.
Mm-hmm.
If we compare to kidney, it's also important. However, kidney has a dialysis machine that can replace kidney function, but not like the liver.
Not
the
like
liver, there's no single machine or there's no method to replace liver function. So that's what we have to have liver in order to live, basically. There are so many problems that can occur in the liver, and at Advent Health Tampa, we take care of patients with liver cancer routinely, almost every day.
Why do you think we mentioned that cancer has gone up in the liver over the past decades? Why do you think that is?
So there are several types of liver cancer. One is what we call primary liver cancer.
Like that's where it starts?
They start in the liver, grow in the liver. That usually occur in a patient who drink a lot alcohol.
Okay. Mm-hmm.
In the United States, in the last decades, a lot of obesity, a lot of fatty liver that eventually will trigger development of cirrhosis and then liver cancer.
Okay.
So from that standpoint, it's going to increase the incidence of liver cancer. Now, the other type of liver cancer is called secondary or metastatic liver cancer. The most common type of disease is colon and rectal cancer that spread to the liver.
You said which is extremely common.
Extremely common. We've seen patients as young as 30 years old who have colon cancer with liver metastasis. So both primary liver cancer are increasing, as well as the metastatic liver cancer. So that's why it's so common.
Well, doctor, here's the good news. Here's why it's such a blessing that you're here on our show this morning and working right here in the Bay Area, because I understand the treatment options and what you're doing with you and your team is pretty unique and exciting in a way that there are hope for these patients. Explain what that is.
So traditionally, when somebody comes to see me with the liver cancer, the first thing that we think is how can we remove this tumor? Because unlike a lot of cancer in the body, those cancers respond to chemotherapy well. One thing about liver cancer, they have a relatively poor response to chemotherapy treatment. So we always think how to remove it. Now, the traditional liver surgery is done through a big incision, maybe about 40 centimeters, through this sort of method, and typically that keep the patient in the hospital for about 7 to 10 days.
Wow.
Because of the magnitude of the operation. Now, what is unique with Advent Health Tampa is we have developed a technique to remove even major tumor with 5 small incisions. So we use the robotic technology, 5 little incisions, each of them about 8 millimeters, and 1 incision is going to be about 2 inches where the liver comes out. With 5 incisions, we achieve the same goal that we achieve with open operation. Obviously, with the small incision, the recovery is much shorter.
Absolutely.
For minor liver resection, many patients leave the hospital about 2 days.
Wow.
For major liver resection, I'm talking major, it means removing half of the liver out, half of the liver out. Half stays in, half out. They usually stay in the hospital average about 4 to 5 days.
Wow. Well, this is exciting. And again, such a blessing to have you here, part of the Bay Area, to where you can help patients. We're out of time, unfortunately, but if someone has questions, and obviously maybe someone has a loved one that's getting ready to maybe face some tough decisions on what to do, how to treat, is this the best way? Give your office a call and maybe get the consult going?
Sure. So a patient that comes to our office, we'll have the first consultation with the surgeons, and we offer treatment options. and we go through with them of necessary preoperative testing, blood work, CT scan, MRI, whatever necessary.
Doctor, thank you so much for being here this morning. Again, thank you for being a part of our community. We'll put that info on our website as well, so it's easy for people to find. We appreciate your time this morning.
Thank you.